physical activity really reduce the risk of cancer? Hi, I'm Mary Johnson. I'm a registered dietitian and owner of Healing Food for Cancer. February is Cancer Prevention Month, and what better time to talk about how physical activity can reduce the risk of cancer. There's strong evidence that physical activity can reduce the risk of bladder, breast, colon, endometrial, esophageal, kidney, and stomach cancer. How exactly does it do this? Physical activity helps to reduce estrogen and insulin, which are linked to the development and progression of cancer. It also helps to reduce inflammation, improve immune function, help with preventing obesity, as well as helping to move any carcinogens that you might have consumed through your diet through your GI tract to exit more quickly. If you haven't been physically active, you may want to start small by maybe taking a 10 or 15 minute walk, so long as it's safe to do so. You'll want to take a few minutes to get warmed up, and then when you get back from your walk, you'll want to stretch. But of course, walking isn't the only way to be physically active. If you have been physically active, you can maybe boost your activity level a little bit by doing a little bit more strenuous aerobic activity like jogging or an aerobics class. It's also recommended that you do strength training a couple of times a week, and that can be done with weights or bands or even your own body weight. During COVID, it might be a little bit more difficult to find a way to engage in some physical activities, but it's not to say that you can't go on to YouTube or join paid service like Beachbody On Demand or Peloton. Have lots of different classes at lots of different ability levels. Physical activity doesn't need to be the traditional exercise that you might think of. You can engage in dancing, so you could have a little dance party with some of your favorite music. Or as the weather turns to spring, it'd be a great time to get out and do some gardening. Even housework is physical activity, so as long as you're engaging in something that gets you up and moving, it's going to be beneficial. The important thing is to do something that you enjoy and that you're physically capable of. I hope this video was helpful. Before engaging in physical activity, you'll want to check with your physician. Thanks so much for watching, and I look forward to seeing you in the next video. I'm going to head out for a walk.